People is proud to present the 40 Days 40 Fintechs, an initiative under its Include Everyone program, which is leading the way in advocating for technology that promotes financial inclusivity. Since 2020, we've profiled over 100 fintechs, and our latest season is shining a spotlight on those breaking down digital barriers and transforming lives for the better. Join us in this financial inclusivity revolution, presented with generous support from the Bill and Melinda Gates Foundation. Follow hashtag 40 Days 40 Fintechs, hashtag Level 1 Project to learn more and get involved in creating a brighter financial future for all.
The 4 Days for Fintechs initiative continues to shine a spotlight on innovators that are using financial technology to serve the unserved and underserved people in Uganda and across Africa. On day 23 of the annual 4 Days for Fintechs initiative season 5, we are glad and excited to host a representative of Clinic PESA. Please introduce yourself.
My name's Onyencha Crispinis. I'm a CEO at Clinic PESA.
Yes, sir. For those who are watching you for the very first time in here, what is Clinic PESA and what do you do at Clinic PESA?
So what we do at Clinic PESA is simple. We know so many people do not have access to healthcare financing. And so for us at Clinic PESA, this is our major goal, to be able to cover this gap by providing a way for people to actually offset their medical bills. So Clinic PESA is typically a wallet that enables customers to save and also use our loan offerings to pay and clear their medical bills at so many healthcare facilities that we actually partnered with across the country.
All right. So how do you do this?
How we do this is using your mobile phone.
Yes.
So we've partnered with MTN for people who do not have access to internet or internet-based phones, so that you can be able to dial *165 *44 hash. And those with smartphones, they can go to the Play Store, download the Clinic PESA application from the Play Store, and they're good to go. They create an account and they start saving. So you can save from your mobile money account. Soon we'll be introducing, you'll be able to save also from your bank account. And when you go to any of the healthcare centers that is accepting Clinic PESA, which today we have over 2,700 across the country, so you'll be able to clear your medical bill. And in case you actually qualify for our loans, we can give you a top-up so that you can be able to pay back later.
Okay. A loan for medical bill clearance.
Yes.
Okay, maybe someone might want to understand this better. Let us assume I'm an underserved patient in Bushenyi district, and I have a feature phone. Take me through step by step of how I enroll in Clinic PESA, I start saving, and at what point am I able to access those funds?
So you're in Bushenyi. All you need to is have an MTN line. So with your feature phone, you will dial *165 *44 hash, and it will ask you to accept terms and conditions, because we provide some terms and conditions. So we'll accept with your mobile money PIN, and instantly an account will be created for you on your Clinic PESA platform. So in there, you can now start saving from your mobile money. You can actually set an autosave, a standing order, and in this autosave, money will be moved on your behalf. Whether it's 500 shillings, whether it's 1,000 shillings, it will be moved on your behalf on a daily, weekly, monthly basis, depending on your preference. And when you've fallen sick, when you go to your next door healthcare center, because I know we are very well much covered in Bushenyi, so you go to your next door healthcare center, you find that Clinic PESA is one of the accepted mode of payments. So then you use your savings to clear your bill. Now, during the time that you actually opted in, we already pre-score you. We look at your usage of mobile money data, and then we pre-score you. So we pre-score you and give you a limit, tell you, yes, a credit limit. So in case the savings that you had saved are not enough, then you can now enjoy the benefit of this credit limit at a very low interest for you to actually be able to receive the treatment from your next door healthcare center. Okay. Yeah.
Yes, now that is someone up country. Now let us talk of a scenario of someone in Muyenga who downloaded the app. Take me through step by step of how she is able to access the money at the time of treatment.
Interesting. So the person in Muyenga who wants to download the app, so they'll go to the Play Store, Google Play Store, download the app into their phone, that is search Clinic PESA, and then download it into their phone. They'll be asked to enter their MTN number. So once they enter the MTN number, a typical PIN prompt will be pushed to their phone for them to accept terms and conditions, and instantly an account is created and you're asked to enter your PIN, typically your new PIN that you'll be using for your Clinic PESA account. Thereafter, you can now start saving. So you can save for yourself, you can save for another, you can pay a bill using the app. And of course, the interesting features now in the app, most especially for maternal, that we have the Clinic PESA Mamas that enables expectant mothers actually to save for the journey of delivery.
Yes. Yes. Now, for how long have you been doing this? And during that period, how many customers have you served? How many people are enrolled in estimation on the Clinic PESA platform? How many health care centers have your service? And what is your coverage across Uganda?
So ever since Clinic PESA started, we started in 2017. We've been here for quite a while. Yeah. So today we have over 1.6 million customers on Clinic PESA platform.
10 customers.
Yes.
All right.
On Clinic PESA platform.
Yes.
And we also partnering with over 2,717 to be precise in terms of healthcare facilities. These are clinics, hospitals, pharmacies that you can typically walk in to receive care, and you're able to offset using your Clinic PESA. Yeah. And we are working every day to ensure that, to see how best we can actually bring in the element of cost of dropping the cost of treatment for customers who are typically using Clinic PESA.
Yes, someone might want to know what is the distribution of these health care facilities. Are they concentrated only in urban areas? In northern Uganda, are you there? In eastern Uganda, are you there? Because there are so many platforms that are marketed as Ugandan, but when you do more research, you realize that they are operational in CBD, operation in the metropolitan only. Yes.
That's a good question. Now, I want to tell the viewer that Clinic PESA is actually cutting across the country. So we have it in all corners of the country. So then when you look at the distribution of healthcare centers, we have healthcare centers that are partners across all districts. We are actually there in Gulu, we are in Barara, we are in Fort Portal, we are in Bushenyi, we are in all those districts.
Are you also in Masaka?
Typically. Yes,
I come from Masaka.
Yes.
And they hadn't mentioned it.
We're actually in Masaka. Masaka is the way through Mbarara.
Yeah. I thought you jumped us and you reached the other part without us serving us. Great stuff. Yes. Now, Ingenia, in the past 12 months, what have been the key highlights from Clinic PESA?
So in the past 12 months, we've been able to actually onboard or serve close to 800,000 new customers. That is kind of a leapfrog as we look at the previous years, where typically it's been the element of growing in small portions, but then this time around it's been quite a large jump, and we believe that as we move forward, we will be able to give this service to more customers.
Yes.
Most especially those that don't have insurance.
True.
Yeah.
Yeah. Doctor, rather engineer, healthcare is very expensive, and it is a basic need. You get sick at any time. Anytime can get sick at any time. Someone will want to know, what is your capacity? How much can you hold? How many customers can you serve? Because you already have 1.3. What is the maximum you can serve?
So today, our platforms have actually been built to serve as many customers as possible. So we can serve as many as, like I said, 10 million customers. Yes, okay. As subscribed.
Yes.
Now, of course, we continuously improve our technologies and services because we know with more numbers comes the element of throughput, the service being slow. Now we ensure that the service is not slow. We ensure that the service is actually reliable and is always available when the customer is actually.
Okay. Earlier this year, I met you, I think it was in Jinja, at a women's Katale activity. And I got some question from a potential customer. They were asking, when they save their money, where is it saved?
So when they save their money, their money sits in a trust account.
Okay.
Yeah, as per the regulations of the central bank.
Okay.
So the money sits in the trust account, and this trust account is held by different banks, different banking partners that Bank of Uganda has approved. So the money is typically safe. Clinic PESA is not allowed, because it has the oversight of the central bank, is not allowed to use this customer's money to do anything. Yeah. So generally, the customer's money is safe. Yeah.
As a follow-up to that, another person told me that these guys of Clinic PESA are fairly young people. Where do they get the mandate to deal with people's money?
Good question. So when you look at the element of governance, there's a whole structure around governance, which is typically also because fintech is a heavily regulated space. I would say for those that have been operating in the fintech space, you will see that it's not an easy walkthrough. The central bank does not sleep. And other regulators as well, they're not sleeping. So it's every day is typically working to make sure you're actually in the right lane. And then when you look at the role of the board and oversight, typically to provide the oversight role to ensure that everything's actually moving as expected by regulation, to ensure safety, and to ensure that the deposits are typically protected.
Okay. Maybe let me rephrase the question for you, and so that you give a direct answer. Most people don't know what central bank is. So allow me ask you, are you licensed by Bank of Uganda? Are you regulated by Bank of Uganda?
Yes. So Clinic PESA is licensed by Bank of Uganda. We hold 2 licenses with Bank of Uganda. That's a payment service, payment system operator license, and the payment service provider license.
True. All right. Yes, sir. Ingnia, most people don't know what central bank is. So it is easy when you say Bank of Uganda, people will know that our money is safe. Because someone will say, what is central bank? Yet when you say Bank of Uganda, of course, me and you know what central bank is, but our underserved and unserved customers know Bank of Uganda. Yes, sir. For the time you have been doing this, I know over 8 years. What are the main obstacles you have met along the way?
So the main obstacles that typically we've met, it's been to do with the awareness creation. Customers take time to actually trust in a service. And over time we've given our customers the comfort and the trust in the service, and that's why they actually save money with us. So that's one of the biggest challenges. And of course, to create awareness, you need to have a bigger pocket. You need to have a bigger pocket to create awareness. That means the investment landscape is suddenly opening up. And before the challenge of investment for looking at Uganda as a place where external investors will typically invest, because that investment is typically what is used for creating awareness, hiring the right teams, And when you look at where Uganda is today, is that it is easy now to attract investment. It is easy to attract investment, and that landscape has kind of been softened. Yeah.
Okay. Yeah, thank you very much for that. As a licensed fintech player, from where you sit, what is the state of Uganda's fintech industry?
So when we look at the state of Uganda's fintech industry today, where I sit, back then someone would wake up and start a fintech, then tomorrow close and disappear with people's money. Now, with the regulation coming into play, typically means that the public's funds are protected. The public's funds are protected, and not any player, not even the big players or even the small players, can be able to do that. Means that you can now put your money and sleep at night knowing that I wake up tomorrow and my money is still safe. Yeah. And the other thing is that it sieves this pyramid schemes from the real services. It gives the public the confidence in these digital services, because digital payments are the way to go. These days, people do not carry money around. All they carry is their phones, and ATM cards, and that is all people need for making payments. Businesses, the small kiosks, the market vendors are all going digital. They're going digital, and imagine that someone has worked months, to put in capital in their business, and then one day they wake up and the capital has gone, because they use that tool or a fintech service that all of a sudden disappeared. So to ensure that these fintechs are here to stay, to ensure that these services are here to stay, regulation comes in handy, and that confidence that it gives the public, because that kind of attaches to the financial system. Now, financial system is typically trust.
Yeah. As someone who has featured on 4 Days for a Fintechs initiative, what do you think is the contribution of this initiative to one, shaping the fintech ecosystem, but also to supporting your cause as Clinic PESA?
So when you look at the initiative, typically, number one is typically awareness creation. Not so many, the platform reaches quite a number of people. Now, this gives a platform for both big players and small players to typically go in the same platform and sell out the service that they are actually extending to the customers. Because you can be extending a very nice service, but no one knows about the service. It's a very useful service. Probably farmers need it, people in the healthcare space need it, but no one knows about it. But now with such a platform, it gives you that voice, to be heard and people to learn about the service. Also contributes to the level of, by the time you get to 40 fintechs, of course, it has to be typically what you're doing in terms of impact. It typically sells out the impact of what you're actually undertaking as a business. And that is good news for investors, good news for investors. Investors correlate with impact, and they also correlate with authenticity of this.
Yes. Yeah, thank you, Ingnia. In 2 minutes, please face your camera and build a case as to why all the unserved and underserved people should opt to use Clinic PESA for their health insurance.
So, why the public should actually opt to use Clinic PESA is very simple. There is that one day when you're actually down and you have no other source. And Clinic PESA is right in front of you to be able to give you that hope again that you can actually receive this treatment. There are frustrating moments when you have to call your friends, family members to try and get some money so that you can get some treatment. But you're a working person, you're a working person, and you wouldn't want such levels of embarrassment. So we call upon you to just pick up your phone, to dial *165 *44# and create your Clinic PESA account. And this is going to save you when no one's actually there for you. Yeah.
Thank you so much for your time. Like you have heard from Ingnia, Clinic PESA is serving more than 1 million Ugandans and working with more than 2,000 healthcare providers. That indeed proves that Clinic PESA is actively serving the unserved and underserved Ugandans. This has been day 23 of the annual 4 Days for Fintechs initiative, season 5. Thank you so much for watching, and see you soon.